welcome everyone to today's webinar. We are very excited for today's discussion. And I would like to thank once again our esteemed panel of speakers for accepting to share your experiences in organizing the walks in different parts of the world. So let's go through the agenda. I will make a brief introduction to the Global Diabetes Walk campaign, as some of you might not be that familiar with this initiative. And then we will kick off the webinar with the first presentation by Tea Tsikviladze. She's a health and care program coordinator in the Georgia Red Cross Society. Then we will continue with Pabitra Babu Soti from the Nepal Development Society, where he's a project coordinator, and he will share the insights about their experience organizing the walks in their country. And following that, Biakatonda Milton Akbor, a director in the Center for Health Promotion and Integrated Development in Uganda, will share his experience about organizing walks in Uganda. After our speakers have presented, we will open the floor for questions and comments. Yildiz, can you please show the next slide? Thank you. So the webinar today is part of the Global Diabetes Walk initiative, which was launched by the World Diabetes Foundation in 2004. It was launched in order to complement the IDF's World Diabetes Day campaign, which, as you know, is celebrated every year on the 14th of November. And it aims to raise global awareness for diabetes, but also to emphasize the importance of physical activity in order to prevent, but also to manage the disease. In 2022, we also launched the Ambassador program, which was a game changer initiative in that it allowed us to organize more impactful events around the world. And this year we celebrate our 20 years anniversary, so we are very excited that we will be launching the campaign soon in June. Our target audience is, it spans a wide range of organizations, but also individuals. And as you can imagine, each one of them has to play a very vital role in amplifying our message and also expanding the campaign's reach. With that said, I'm ready to open the floor for our first speaker, who is Teiko from the Georgian Red Cross Society. So please, Teiko, the floor is yours.
Thank you very much. Thank you, first of all, for giving this opportunity to share Georgia Red Cross experience about the Global Diabetes Walk. I would like to greet all the participants, and of course, it's a pleasure and honor for me to be here and to represent Georgia Red Cross team's work. So I will start with the presentation, and I will represent what Georgia Red Cross Society does and how we organize and why we consider as important participation and joining to the global walk. Next, please. But before we start, I think it will not be bad if I say 2 words about our country, which is small country and is located in the South Caucasus. It is not a big country, and population is also not very large. It is over 3 million people. So Georgia consists of 11 administrative regions and 69 municipalities. And you see on the map our country, you see which countries we are bordering. So to have more or less idea where we are, where our country is. Next, please. And who we are, Georgia Red Cross Society is one of the national societies which is member of the International Red Cross and Red Crescent Societies Federation. It was established in 1918, and after our country, Georgia, gained independence, it was in 1991, a national society was recognized by a presidential decree in 1993. The National Society has also its law in the country and auxiliary role to the public authorities in coping different crisis situations. So it is the unique non-governmental organization in the country. National Society is member of the Federation with its mission is following our fundamental principles. So we are a voluntary humanitarian organization. And the National Society, as all other national societies in the world, implement all its humanitarian work with active involvement of our volunteers and staff members in our branches, which is all over the country. And our main directions, as you can see, is health and care direction, where different programs are implemented, disaster management direction, youth and volunteering development. As I mentioned, volunteering in Red Cross and also in Georgia Red Cross Society is one of the most important directions, as all the actions are implemented with their help, support, involvement, and with their motivation, let's say. And on the next slide, we will show you where we work. So, as I mentioned, there are more than 64 municipalities, and the Georgia Red Cross has its representation, it is branches and activity centers in more than 40 municipalities. And in all over the country, almost in all the municipalities and in every region, we have representation. Of course, not all the branches are so equally active in terms of implementation of different projects, but however, all of them are part of a national society. And what about health and care activities? They are implemented in about more than 16 branches. And if we talk, and if we focus more on diabetes prevention, we implement activities focused on diabetes in the target regions in the frames of the project, and in general in other branches. So I should mention that we are very happy that World Diabetes Foundation is supporting this direction, and we now are implementing in the 2024 the third phase of the program, and we were starting in 2013, and we were starting the program implementation with only one district, which is Gardabani. Then in 2018, it was expanded our coverage, and 4 other branches were added. And now in 2024, as I mentioned, we again started implementation of third phase, and now awareness raising activities in the frames of the project are implemented in all the branches where we have worked before, and 2 other locations are added as target for detection and care activities. Please, next slide. And on this slide, you can see which areas are now targeted in the third phase and why are they selected and most sensitive, because they are bordering, they are in the borders. In Shida currently, for example, we have these territories bordering in the occupied part of our country. So the need is really high. Therefore, we now in the third phase are conducting our activities in these two regions. And what we do to, yes, the next slide is okay, thank you. Uh, what we do to prevent diabetes and promote healthy lifestyle in Georgia. Of course, the existing program supports us very much to do as much as possible in this field. And we will not talk, of course, about project activities, which are huge and very important activities, but we will just focus on organizing week dedicated to the World Diabetes Day. And in the frames and of celebration, let's say, of World Diabetes Day in November every year since 2014, we joined the Global Diabetes Walk, and of course, we are happy that we are one of the ambassadors since this time. We initiate walk. Countrywide, as I mentioned, we have branches all over the country, though maybe the projects are not implemented in all of them, but all of the branches have some access to our dissemination part. They receive informational, educational sessions about diabetes, its prevention, and for November 14, all of them are mobilized. But of course, it should be mentioned that it was not like this from the beginning. We were starting from the one target municipality, but from time to time, all other branches, seeing that people are very happy, it is very effective and interesting action. Of course, more and more branches are motivated, they're willing to join this celebration of the World Diabetes Day, and they have willingness to be part of this, let's say, campaign. So we organize informational sessions for project leader volunteers, for our beneficiaries, and of course, general public. But on Diabetes Day, on 14th of November, we celebrate the day, and we, of course, join our partners, state, non-state actors in all the events, campaigns as much as we can. It's at central or branch level. Among them, there are some media campaigns, and we are also part of this. Georgia Red Cross organized walk, and what is important that this walk is organized in parallel in different locations. And in the presentation, we have 12 because last year it was 12 locations, and we should say that as I mentioned from the beginning, the number of involved branches was increasing, but the COVID time, of course, influenced this event as well. Though when we are more or less oriented with the how to live with COVID, with the safety rules and all the instructions, we are trying to organize work as much big scale as possible. But now, of course, we are again back to the ordinary work. Annually, over 10,000 people are reached with the key messages through work organized by our staff and volunteers. Next slide, please. Of course, every good thing has also some challenges which we need to consider. So, as we will are trying to share our experience, we also thought to give you ideas what you should consider if and when you decide join the walk and organize something event like this. Of course, it is political and safety security issues. So what we mean that when you organize such a big event, so many people are outside, they are walking with some slogans, with some key messages. Of course, the community as well as some stakeholders should be aware what is it, who does this, what is the idea. So that's why, of course, you and we have to be very concrete, and of course we have to work before organizing something. We have to promote the event and promote correctly, timely, in order before November people are aware that such kind of event is being planned, and many people will be gathered and will have one message. So everybody should know and understand the importance of this event. Community and public mobilization, of course, it can be challenged, but everything is somehow connected. So if there is good promotion of the event, if we have good image and people more or less know us and our activities, then of course community mobilization will not be so difficult, but still it can be challenge. About logistics and finances, of course, to organize big events, we know that it needs finances. For example, during the walk, our participants are disseminating some informational education materials. They need some visual uh, materials. Yes, they need uniforms or something for visual effect. Let's say so. But finances and good logistic is very important. Though from our experience, I still should say that we have experience when without any budget, without any program, we are organizing these events, and the branches that are joining the event with their own willingness, they are not often supported financially. But even on the pictures, you can see that the motivated volunteers are writing on big papers themselves the key messages, and they are promoting as they can. So the main idea is to have willingness to organize it properly, to promote it properly, to communicate it properly with the stakeholders. So and of course finances will also be very supportive.
As agreed, Echo, I'm letting you know that it's time to wrap up the presentation.
Okay, I'll be very quick. Next, please. So walk as a tool, I will be very quick. So it is very good tool to attract attention of potential beneficiaries of the communities, and to use it as an advocate tool to invite communities as behavior change agents. And it is also motivating community and our volunteers. And on the slide you see the certificate which I personally received when we were starting, and our volunteers are receiving, and Georgia Red Cross is receiving the certificate annual, which is really motivating our volunteers. And we had such cases that the 1 year we organized the event, and next year people are involved and they are asking. We also received the certificate that our friends. So of course it is very motivating when a person feels that he or she is recognized as a behavior change agent or sees his or her input. So thank you very much for this certificate, for this motivation for our volunteers and staff. And next slide, please. Next, yes. And on the slide, my colleagues, all the participants can see our sentence, join the global work, become ambassador of change, and you will really feel much better. And when you get the certificate, it will also be very pleasant. For more information, you can visit the webpage of Global Diabetes Walk, and we also are ready to communicate, to give, share with you more if it will be needed. So thank you very much again for this opportunity on behalf of me and my colleagues from the Georgia Red Cross team, and we hope the next year walk will be also very effective and successful, and wish you good luck. Thank you very much. And if you have any questions, of course, I'm here and I'll be happy to answer. Thank you very much.
Thank you. Thank you so much, Teko, for this. And everyone joining, if you have questions and comments, please note them down. And we will take it by the end of this session after we heard the presentations from Nepal and Uganda on the Global Diabetes Walk there. So thank you so much, Teko, for this. It's quite impressive with the reach of 10,000, as you stated, and wonderful to see the different ways in which you use the walk. This leads us very well into the next presentation from Nepal Development Society. And so, Pavitra, the floor is yours.
Hello, good afternoon and namaste, everyone. I am Pavitra Babu Swati, project coordinator from Nepal Development Society. First of all, I would like to thank the organizer for giving me this opportunity to share our experience as an ambassador of World Diabetes Day. Now I am here to present some of our experience as well as the plan for Diabetes Day 2024. The topic for presentation is health, work, awareness, and experience from Nepal. Next slide. First of all, let me introduce Nepal Development Society. It established in 2013. We have head office in Kathmandu, and other offices are in Chittagong and Pokhara. Altogether, we have 32 staff. We are registered in District Administration Office Chittagong, and we are also registered in Social Welfare Council and PAN and BAT. We are a leading organization, leading research non-governmental organization in Nepal, and we have published more than 200 scientific articles. We have well-equipped research facilities and software. We have all total 1.5 million US dollar budget. And if you need some additional information about Nepal Development Society, you can go through www.netsnepal.org.np. Next slide, please. Now I would like to briefly share the activities done by WDF project in the past. For the first time, we conduct secondary school level quiz competition on health and NCD in 2017. 10 schools participate over there, and more than 500 students and teachers participate as an audience from different schools. Next slide, please. You can see some picture there. Similarly, on 2018, running and mini marathon of 3.5 kilometer was organized. 150 people actively participated in running. Similarly, IEC material and T-shirt with health message about diabetes were also distributed. You can see some picture related to running program. Next slide, please. Another program is cycling, that is Round the Rupa Lake, that is named as Round the Rupa Lake cycling event. It was around 50 kilometer, and there were altogether 70 participants who were wearing T-shirt with health message and holding up some banner as well as display card. You can see some picture related to diabetes cycling event. Next slide, please. Another program is diabetes walk program. Diabetes walk has been organized very effectively since 2020. And the active participation of the community has highly encouraged us to launch these different diabetes day celebration related event. The participant on this diabetes walk participant display card is holding display card. They are wearing T-shirt with diabetes message and visibility. They also use banner for visibility and as well as for the displaying of health related and non-communicable disease related message. Similarly, diabetes related audio and jingles, diabetes screening camp, and distribute leaflet to the community. You can see some pictures. Next slide, please. These are also the representative picture from Nepal on the occasion of Diabetes Day. Next slide. This is also some representative picture on the occasion of Diabetes Day. You can see some pictures over here. Next slide. In challenge, for the challenge, while conducting this event, we face some challenge that is more than expected number of local interested to participate. That is challenges for us. And from this event, we have a lesson learned that double the number of the printed T-shirt for those who came to participate unexpectedly. And similarly, distribution of IC and display board a few days before the walk so that we can know the actual number of the participants for Diabetes Day. Similarly, another lesson learned is that appeal the government for sharing of the budget for Awareness Day. We have some interesting fact from Nepal that many communities and individuals were willing to participate.
Can you hear us, Babita? Oh, yeah. Please continue. You are back.
Okay. I think there may be internet problem. So I will continue from interesting fact. In the situation where we can provide only normal T-shirt and cap, we can make 100 of people attend on that diabetes walk event. Yeah. Next slide. Now I want to share about the planning for Diabetes Walk 2024. This is the map of Kaski district. Altogether, we have 5 local level in Kaski district, but we have planned to organize 4 events in Kaski district. We will conduct 4 events in Annapurna, one in Annapurna Rural Municipality, another in Machapuchre Rural Municipality, and Madi and Rupa Rural Municipality. We have planned to cover at least 25 to 30 people in each site, excluding of NETS staff. If we have, we can get some additional fund, then we can increase the number of participants in each event. 400 screening for blood sugar, around 400 leaflet distribution with health message to the community. And indirect beneficiaries will be more than 10,000 people from our working area. Next slide. We do as for previous diabetes walk event. First of all, we will walk with banner having health message and diabetes related message, and participant will wear t-shirt with visibility and diabetes related message. They also distribute some leaflet to the community for creating awareness on diabetes. Also, diabetes radio related audio broadcasting from by using speakers. We will also conduct screening camp, and we have planned to cover at least 400 people by screening camp. Similarly, placard with slogan that is held by our individual participant. Another slide. For the collaboration, we have planned to collaborate with municipality, local club, 2 leading organizations and mothers group, different government and non-governmental organizations, medical college, World Diabetes Foundation, and other funding agencies. For the advocacy, local newspaper and radio, social media of Nepal Development Society, Nepal Development Society website will be used. For the long-term plan, we will take the initiative to celebrate the diabetes work program as a national program. We have similar type of program, that is May Measurement Month program, that has been a milestone for Nepal Development Society, where there is support of 100 of volunteers to the screening of blood pressure of thousand number of the people. About 75,000 people were screened in 2019, and nowadays government of Nepal also have shown its concern in that program. That is our experience on another program similar to diabetes work. And now next slide. For the recommendation, it is advisable for the organizer to take the initiative to arrange a small amount for t-shirt, cap, and banner. We have limited resources, so if we can arrange a small amount for the t-shirt, cap, and banner, it will be beneficial for us for the increment of participant. Another. Okay, thank you. If you have any queries, let me know. I will try to answer all of your questions.
Thank you so much, Pabitra, for this presentation and all the lovely photos. I think it's quite inspirational to see the types of awareness activities that you have beside the actual walk, especially the biking. I'm a big fan of biking, so that was really nice to see. Maybe we should pick it up here as well. Thank you so much for sharing. And please, if you have any questions or queries, we will take them by the end of the session. We now will shift our focus to Uganda, where I know we have a strong advocate for diabetes going to share some experiences from there, and a very hands-on approach to what to do before, during, and after the walk when you want to organize a walk and maybe need some logistical inspiration and support as well. So please, Milton.
Important. Hello everyone, I'm called Milton from Uganda, and I work with the Center for Health Promotion and Integrated Development, which is an NGO and where I'm the director. Next slide. Center for Health Promotion and Integrated Development is a Ugandan NGO that is committed to community-based prevention and health promotion initiatives, but we majorly focus on diabetes prevention in and we are happy that last year we are elected to be diabetes ambassadors. Thank you for that. And it's very important to organize global diabetes work, of which have been part because of some reasons. One, it brings people together. Those who are suffering from diabetes, the caretakers and health practitioners, they come together as one group, support each other. Also, it offers an opportunity to raise awareness to the public, to know risk factors and how it can be prevented. It also has a unique power to influence public opinion because of it affects the media, the civil society, the government, and because of the importance of that, it influences public opinion so that it can shape government's policy on the public health agenda. Next slide. In organizing diabetes work, it is into 3 parts or stages. One, what should you do for the work, during the work, and after the work? And that is the planning stage. Planning is very, very important if you want to have a successful event. You set the goal because the goal of that day is to raise awareness, but you must also have a budget. So create a budget that is sizable, which you can manage. You should anticipate the expenses that is where you will spend, and also the source of the income. The source of income may be for sponsorship. You may sell like t-shirts, you may solicit from friends, but the budget must be there if you want to have a successful event. Also, you have to plan the route and also set the range. Where are you going to pass? Is it through streets, town streets? Is it outside in the outskirts? So, and how long is it? Is it 10 kilometers, or you may even have a marathon? But I would encourage 5 kilometers because that one is easier to walk, and even older people can walk. The disabled can walk. So it's more distance is very, very important. Also seek permission from authorities, because every country has laws that govern public gatherings. For example, in the Public Order Management Act, whereby you cannot have a gathering without permission from police. Therefore, I encourage seek authorities, seek permission from authorities so that they can give you a green light to perform this. Also promote the event so that people may come to work, they may come to attend. You may promote the work through various media. Social media is a separate group. On X, on Facebook, they use WhatsApp, use Facebook, promote the event so that it may attract many people. Also, you can use radio, you can use TV if you can. Also select the venue which is accessible. Don't select the venue which people cannot access. It should be accessible and secure. Also secure staff price. We are going to use many things. Public address system, you need chairs, you need benches. All this needs to be planned for in advance. And to do this, establish a planning committee so that it can help you to manage the event. Next slide. Still in the planning stage, register your work on the WDF website. It's there, you register it so that they can know that you're going to participate. Also invite people to work and also to attend the event. In addition to promoting it through the other platforms, you need to write invitation letters to people who matter, especially the stakeholders. Invite them to come and attend your work. Even like especially the age, they may come to attend the event for screening. So do not only promote it through the other platforms, but use other avenues, invite people to come and attend the event. Also, partner with other like-minded organizations and health units. When you partner with them, one, they are going to reduce the cost that you would be encountered. For example, when you partner with health units, you may find they have the screening kits. Those ones, instead of buying, they will provide. Also, they will increase on the audience, people who are going to participate. Like in that picture, we partnered with the Royal Club because they also have diabetes program. So we invited them and they supported us, especially in providing some funds. So I encourage that we partner with other organizations and help in this. Next slide, please.
Thank you, Milton. I just want to interrupt you briefly, sorry. Just to let you know, everyone who's taking part, that the official time of the session is actually over now. So if you have other obligations to tend to, please do feel free. If you have a few more minutes, please stay tuned as Milton, you will wrap up and you have 2 more minutes to finish the presentation, and then we have some questions by the end. It's just to let you know that if you have other things on your agenda, please do feel free to attend to those, of course. So Milton, back to you, 2 minutes, and then we have some questions.
Okay, thank you. Next slide. During the work, and that is the D-Day, the purpose is to make sure that you raise awareness, and on that day, not only about work, but a variety of activities, have health screening, let people be educated, invite health educators, educate people, also provide refreshments, provide t-shirts, provide first aid, also involve the police for traffic guides, recruit volunteers who are going to help you with your work. Next slide. And after the work, it's very important to analyze the event, what went wrong, what went well, so that it can help you to improve. Seek feedback from participants, seek feedback from other people who participated in the event, so that it may help you to improve. Follow up with participants by sending them messages, by thanking them for participating, so that they may come next time. Also share the event photos to the WDF and also participants, especially the institutions. Next slide. The challenges are quite many. The budget constraints, of course, you may find you don't have a lot of resources. That has been a challenge in managing an event. What attitude of people, especially when they see that you are partnering with WDF, they think that so they're expecting a lot from you. Politics, like in Uganda, when people know, especially those in the government, know that you're going to gather people, they may think that because of politics, they may take time to respond to you. And a favorable weather also, you may plan everything, but at the D-Day, already and seeing that picture, what happened, also stakeholder engagement, they may also take time. Recommendations, I recommend that you create affordable budgets that you can manage. Also, start planning very, very early, so that it can give you ample time to organize everything. So that people may come. Involve people living with that, because that will give it a bigger picture, and people will know what they will work for a justifiable cause. Partner with other organizations, involve community leaders, and also select venues that are weather friendly. Next slide. I can welcome questions. Thank you.
Hildis, you're on mute.
Thank you. for that, Milton. Wonderful to hear the inspiration from Uganda and that very hands-on list on what to do before, during, and after the walk. I hope will be helpful for those of you who are planning to do your own walk. And surely there are challenges, but also based on what we have seen from the presenters today, with very few means, it's actually possible to arrange a quite efficient walk with a lot of attention and good energy. We are over time, as I said, but we have time for a few questions from our participants. And I can see we have a question from Sarah, please.
Yes, thanks, and thank you to all the speakers for sharing a lot of, I think, inspirational talks in the way that you've organized the walk. Now, if you asked about how to engage the, you can say, health community as well, maybe I can ask you, Pavitra, from the Nepal Development Society, because you share some good examples on various activities that you've done with your volunteers, and also mentioned a challenge that actually more people signed up for the walk that you had anticipated. So your volunteers must do a great job in reaching out to people. So how do you engage your volunteers in the Global Diabetes Walk?
Thank you so much. Thank you so much for your question. Actually, I have internet problem in previous stage of your question, so I cannot listen all question. But I can hear one volunteer related question. Yeah.
Yeah.
And it's of
just to
volunteer-related
summarize,
question.
and this is what happens, Pavitra. Sarah's question was actually exactly related to how you engage your volunteers for the walk.
Yeah, for the volunteer mobilization, we have asked with some of the medical college from Pokhara. We will also use some female community health volunteer who are also a government structure who are working with community level. And we also use some volunteer from health facilities, which is under the metropolitan city. They are huge. And sometimes we also use some local club as well as some mothers group, two leading organizations. And for that, we will write one letter to them, please support us for this purpose. And then they are very interested to participate in this type of program because they also want to engage in the awareness raising activities. Yeah, that is our previous experience. I think most important thing is that mobilizing medical college student is very easy for us. I have already talked about May Measurement Month. In that event, we have mobilized many volunteers, more than 100, 200 volunteers within a month. And they are mobilizing for screening of hypertension. And we can make a change for the screening as well as creating awareness to the community.
Thank you so much, Pavitra. And I think that's just a wonderful learning that is coming from the experience that if you have to like prioritize your recruitment efforts, perhaps focusing on medical schools of some sort is actually a good place to start because there will be an interest and a knowledge from the beginning, and students tend to have time and also an interest in organizing and volunteering with these things. So I think that's just a wonderful advice to share with also the other participants. Thank you so much for that. I see that we have a question from one of our guests called Faith. Please. Please share your name and the organization you come from, and then your question, please.
Yeah, thank you. My name is Faith Ochieng from Kenya. This is
Welcome.
the first time I am joining these talks on diabetes, and I have a lot of interest in non-communicable diseases. So that's the reason I also joined this forum. So I have a question to maybe all of us in the forum. In the interest of just doing diabetes work, and I am assuming that the organizations that are on board have this as a continuous activity that happens every day to educate people on diabetes and what preventive methods they can put in place to avoid being diabetic. In that interest, and coming from sub-Saharan Africa, we are very cultural and religious. I just want to know how such cultural questions or religious practices, when they come up, how they are addressed by especially the healthcare workers. I heard one of the presenters say that they engage healthcare workers in radio talks. Have you come across any episodes where such come up, and how is this addressed to practically help citizens to deal with diabetic conditions? Thank you.
Thank you so much. That's a really good question, and also a very big question. I think, but it's really one of the challenges I'm sure many people have. I see, Teiko, you raised your hand. You perhaps have a response to this?
Thank you for the question. Maybe it is not the one and only response, and as you mentioned, it is very important and interesting question. I just remembered in this case, of course, all of the organizations who work on this topic have their strategy, and one of the very important part is educational work, information sharing about importance of all these steps and things like this. But from our experience, it is very effective to have self-support groups which worked in all two phases very well. And also cultural issues was mentioned. Then in the self-support groups, it was exactly very well seen that these communities have the same cultural approach, same understanding. Also, religion is mostly the same in the same community. So they can speak on one language, and in the community, one can be more informed, have more information, more understanding, have more knowledge about diabetes, and maybe more experience as well, and can share to others who have less. And sometimes they have more power, maybe even, and they can assist and support them in all the cases to have medicines or to have access to care and things like this. So just to be very brief, I remembered, first of all, the self-support groups from our experience. Thank you very much.
Thank you so much, Teiko. And I think that's, I hope that is a useful answer for you, Faith. I think it's something that everyone who works in this field is facing every day. And so the advice that I take from you, Teiko, is to really be mindful of the cultural differences, and then make alliances with local groups that are actually from the community and who know the codes and the culture and how to promote and raise awareness in a way that is culturally appropriate for that particular community. Thank you so much for that. I see we have a question also from Newton, one of our participants also joining from Kenya, please.
Yeah, thank you, Yildiz, for the good presentation, and also thanks to the facilitators from Georgia, Nepal, and Uganda. But my question is briefly on the institutionalization of the work. I'm yet to see from the three countries the involvement of the local governments because the work is important, but the institutionalization of the work is to ensure that even when they are the time for the global diabetes work has not arrived, what is the role of local governments to ensure that working in these cities and these towns is easier, it's simple, it's efficient, and in a way that it encourages the physical movement of people from one area to another. So as much as we have episodes whereby we have global diabetes walks during these sessions, it's also important to see the role of local and even national governments to ensure that walking is not something that is discouraged maybe by the structure of towns and areas. And maybe that's something I would like to hear from either the facilitators or even the presenters at large. But thank you and good work.
Thank you so much for that question. I think, Effie, do you have a comment for this? Or is it something that we need to direct at the more local level?
I think, you know, I've heard this question before, and I've heard from other partners that this can be a challenge, especially in countries where there are where there's no infrastructure. For example, I heard this from partners in the Middle East, where they were saying that there was a challenge that people, even though they want to walk, but they cannot really walk outside. But I'm also wondering if we can hear more from the speakers, because they are, I guess they have the local experience. Maybe they have more insights to share.
Yeah, so this being the last question of the day, I wanted to hear then from our speakers. Do you have a response on this in institutionalizing the walk with local governments? I can see, Papitra, you are perhaps have a comment for this.
Thank you so much for another question. First of all, the local government is in the context of Nepal. Our local government is also conducting awareness program on non-communicable disease, including diabetes. Yeah, and often, sometimes local government representatives are also involved in our activities. They are close with us. And for example, I have already talked about the running program. In that program, our mayor of Pokhara metropolitan city is also participate as a chief guest in that program, so that they are known about importance of work, importance of exercise for the prevention and management of diabetes related activities. We have also experience of providing some fund from health section of metropolitan city. We can get some local resources, fund, and also we can mobilize some of the health facility staff and other female community health volunteer. They are also as a part of Nepal government. We can mobilize them. Some of the program, most of the program, we have tried to include female community health volunteer as well as all of the health staff, so that we can create awareness to the community. Yeah, that.
Thank you so much.
Yeah, okay.
Yeah, thank you so much. And thank you for the questions and for the responses. This is, as I said in the beginning, a big topic to cover in 45 minutes. And we've had 3 good presentations. So what we will do now is actually conclude and say thank you. And then after this meeting, we will send out the slides, so that you can actually take a look at the points made by our presenters today. You will also find relevant links and so on for the walk, so that you can register. I will also make a contact list for everyone who had registered for this, so that you can see sort of name, email address, and the organization, and reach out, hopefully to continue the conversation, and also maybe hear how others have approached challenges in this. And so I see a final question. Yeah, please, of course. Please state your name and the organization and country you come from.
Yes, I am Dr. Edita Blokaj Shola. I am a little shy. I see a lot. Yes, and I wanted to be the last one to make a question. And happy anniversary, happy every Global Diabetes Walk, happy ambassadors. I am so honored to be in front of you. I did one spot from the deep down my heart, and I allowed you to see that I did it for all my heart. And I don't have question. I'm from Kosovo.
Nice to see you and welcome.
Yes. I did it by myself, all the things. I want to thank you, Effie, for every detail that you helped me and your team, and I did it for you.
Thank you, Dr. Edita.
What a lovely way to end this. Thank you so much for sharing that. And that's, I think, also a valuable point, that of course you can organize this as part of a big organization where you have an infrastructure, you have a budget, you have all the things in there. But what is also possible and so valuable with this tool to raise awareness is that you can also do it by yourself. It must have been tremendous amount of work to conduct this, but it's such a lovely point, and thank you for sharing that. That actually it is a walk, and it's supposed to be simple. So it is possible. Yeah, sorry.
When I was a little girl, and my teacher told me what you want to be in future, I told I want to be a doctor because helping the sick and people in need will be my only aim in life.
Thank you so much. Thank you so much. So we're really covering inspiration from everywhere and all the spheres, and this is really wonderful. I will, as I said, send you an email with the slides and the contact list, and also some more information on how to join the walk. And so from us at the Global Diabetes Walk, at the Partners of Partner Academy, and of course at the World Diabetes Foundation, thank you for listening in and joining, and see you in November for the walk.
A big thank you to all of you, and please reach out to me if you have any questions.